Welcome to another episode of China Update, where I provide you guys with the most up-to-date political, economic and geostrategic analysis on the world's number 2 economy. My name is Tony. Let's jump in. Okay, happy Saturday everybody. I hope you're all enjoying your weekend. One minor housekeeping matter before we dive into the episode. It does appear that I myself now have COVID. Symptoms are currently mild and I hope to continue producing videos as usual, but if the symptoms do worsen, there is a small chance that on Monday and Tuesday we may not see videos for China Update, so that's just a heads up for everyone. But like I said, I do hope to continue producing videos for you all as usual. If you like today's video, don't forget to hit that like button, and for the 50% of viewers who currently are not subscribed, if you do get some value from these videos and you like the occasional episode, maybe consider subscribing. This is also a big help for the channel as well. Okay, now let's continue with our ongoing coverage of China's opening up and growing first wave of infections. Today's video will primarily be on these developments. And first up, we are now receiving fairly concerning first projections of how bad China's death toll could be with this first wave coming now in the middle of winter. Of course, we understand that projections like this can be notoriously inaccurate. This channel isn't seeking to engage in scaremongering, but we do now have some of the first projections and the death rate models from fairly reputable sources, and so we need to at the very least examine them. UK-based The Economist writes this week that based on their models, which is built on the work by Jun Cai of Fudan University in Shanghai, as well as others, shows that China's COVID death toll, quote, could be massive, end quote. Their model calculates the trajectory of China's outbreak under different scenarios based on estimates of the rates at which people become infected or get sick, recover, or die. The outlet concludes conservatively, quote, the results are shocking. If the virus is allowed to spread unencumbered, we predict that 1.5 million Chinese people will die, end quote. Another research paper authored by 3 University of Hong Kong professors published this week warns that if Beijing does not roll out moderate preventative measures during the reopening phase currently underway, approximately 1 million Chinese will die. Their modelling predicts a best-case scenario of 627,000 to 742,000 deaths during this reopening phase. The paper's figure is also in line with several private sector forecasts of about 1 million deaths during the winter wave of infections, reported by the Financial Times and others earlier this week. Whatever the numbers end up being for the first wave, most, both domestically and internationally, agree that China, with its largely virgin population, is facing what will likely be the world's largest outbreak to date, with tsunami and tidal wave being common words employed by reporters and analysts to describe what the next month will be like for China. Meanwhile, Beijing continues with its keep calm and carry on-esque state media blitz. Respected top respiratory disease expert Zhong Nanshan was brought out again this week for the second time to calm nerves about Omicron and the sudden policy shift away from zero COVID. Dr. Zhong said that in most cases Omicron is so mild that it should be called a coronavirus cold, explaining to the country, quote, Omicron has a fatality rate of about 0.1%, about the same as ordinary seasonal influenza, end quote. He also expressed on Thursday that the 10th edition of China's so-called COVID-19 control protocols will be released soon, which, quote, will benefit economic development on the basis of active epidemic prevention, end quote. Multiple Chinese cities, including Beijing, the capital, as well as cities in southwest China's Sichuan province, central China's Hunan, and east China's Zhejiang and Anhui provinces, have begun a second booster vaccine rollout. An official with the National Health Commission said on Thursday that China is also carrying out a survey to identify people most susceptible to COVID-19 infections, including the elderly and those with underlying diseases. More than one analyst has pointed out that such a survey perhaps should have been done before abandoning zero COVID, especially considering that zero COVID measures had bought China months of time to do so at tremendous economic and social costs. And a messy reopening like we're seeing now will mean even higher economic and social costs. Yesterday we explored poor November data. December's may be even worse. Now, before we move on to the healthcare system itself, which is already under tremendous strain, one more development on the domestic narratives front should be covered. This week, WHO Director General Tedros called on China to share more information about how the virus began in the central city of Wuhan. Beijing hit back at the comments, claiming to be an exemplar of transparency. Quote, China is the only country that has invited more than once WHO expert groups to come into the country to conduct joint SARS-CoV-2 origin study. We have shared more data and research findings on SARS-CoV-2 origin study than any other country. This fully demonstrates China's openness and transparency. End quote. Hey guys, like I said before, if you're enjoying the episode, don't forget to hit that like button. And as always, anyone who can go that extra mile and help me keep China Update sustainable, it's just me who makes these episodes, and the channel relies primarily on subscriber support. Patreon and Buy Me a Coffee links are in the description below. As always, thank you so much everybody for the ongoing support. Meanwhile, the pressure on the healthcare system continues to mount, with very real fears that parts of the system will see temporary collapse in the next month. Chinese financial media outlet Caixin writes today, quote, China is facing a crunch of medical workers as many succumb to COVID-19 amid a surge in cases throughout the country, placing a strain on the nation's healthcare system and forcing some hospitals to ask sick staff to keep working, end quote. The outlet reports that outside the major cities, the situation is fast becoming very serious. Quote, in a county-level city in central China's Hubei province, one doctor estimated that 20% of medical staff in his hospital had been infected, and that percentage reached 50% among those working in high-risk settings, including the fever clinic and emergency department. End quote. Faced with a shortage of medical workers, some hospitals in Beijing, Guangzhou and Sichuan provinces have asked graduate medical students who are undergoing hospital-based standardized training to participate in the treatment of emergency and fever patients. We remember on Wednesday the death of a 23-year-old medical student at West China Hospital of Sichuan University caused an uproar online. The 23-year-old student, surnamed Chen, died of cardiac arrest Wednesday night after attempts to resuscitate him over the previous 24 hours failed. Since then, we have learned that chat logs and medical records circulating online imply that Chen had tested positive for COVID-19 and had a fever for 3 days, but was asked to continue working by his superiors. Angry comments online accuse the hospital of working the young man to death. The hospital has denied that it was a COVID-related death. As we have explored in previous videos, many hospitals, even in wealthy cities, are already running out of medical supplies. And it's not just hospitals that need them. Chinese financial media outlet Economic Observer reports yesterday that 5 nursing home presidents they spoke to reported that they could not get antigen drugs, couldn't get through emergency calls, and, quote, lacked medical emergency plans, end quote. Another Chinese financial media outlet, Yicai, writes that many Chinese residents have turned to overseas buyers to help buy foreign drugs. UK-based Reuters writes that, quote, China's COVID scare sparks run on flu medicines, test kits as far away as Australia, end quote, reporting that drugstores from Melbourne, Australia to Hong Kong have sold out of fever medicine brought up by so-called daigou Chinese buyers to send back to the mainland. The financial system is feeling the strain too. The UK-based Financial Times reports yesterday that China's insurance industry has, quote, slammed the brakes on selling low-cost policies that cover COVID-19 infections as it tries to avoid huge payouts and disputes from an oncoming wave of cases caused by Beijing's relaxation of strict zero-COVID policies, end quote. The management and resilience of China's medical system will be critical over the next month. Multiple experts, including prominent infectious disease expert in Shanghai, Zhang Wenhong, have stressed that the ultimate death rate for this COVID wave will be linked to how the medical system performs and whether or not large parts of it collapse. Okay, that is today's episode of China Update. Thank you so much everybody for watching. Like I said, if my symptoms worsen, there may not be a video on Monday or Tuesday of next week, but I do hope to have them up. I hope you all have a wonderful weekend wherever you are, and I will see you all, hopefully, on Monday.